Good afternoon, everyone, and welcome to Mental Health for Mental Health in the Workplace. Yes, so we will begin now. We'll start with a prayer. God, today we pray for our nation's teachers who carry with them the mission to impart knowledge and wisdom to youth and adult learners alike. We pray for the ability to assist them in coping with stress, anxiety, depression, and other mental health issues, which they and their students may be dealing with through this pandemic. Bless us today with the opportunity to learn more through your grace. Good morning, everyone. So before we start, we'll just go over a couple of house rules. So first, please keep your mics muted throughout the webinar. This is to ensure that there is minimal noise and that we don't interrupt the flow of today's webinar. Next, if you have any questions, please type them in the chat box or the live chat on YouTube. Our team will be gathering them for the Q&A later on. Also, if you are unable to access through Zoom because our Zoom room is now full, kindly go to the YouTube stream. You can access this via bit.ly/mentalhealthyt. For those of you who are also asking about the e-certificates, these will be given to webinar attendees. This will be given after you filled out the evaluation form, which will be shown toward the end of today's session. We will also be sending the link. Kindly expect the e-certificates to be sent to your email a week after today because we have a big volume of attendees. Thank you so much. And last but not the least, please keep all of your comments and questions respectful so that we can have a great discussion today. Now I'll turn the floor over to Mr. Miloš Stojanovic, our Health and Drugs Program Officer at UNODC, for his welcoming message.
Thank you so much, Wina. Honorable colleagues, distinguished guests, dear teachers, it is my great honor and privilege to welcome you all to the first of the series of the Psychosocial and Mental Health webinar for teachers organized by the UNODC, United Nations Office on Drugs and Crime, and supported by the Bureau of International Narcotics and Law Enforcement Affairs of the Department of State. Special thanks goes to Ms. Kilia Cummins, Director, INL Manila U.S. Embassy, and Ms. Jonah Santos for their support and available opportunity to implement essential drug demand reduction activities and strategies in Philippines. We are very happy to acknowledge outstanding support availed by the Department of Education and are privileged to work together and to have today with us Dr. Mark Corazon Dumlai, Chief of the Health Division that will represent Attorney Rev C. Escobedo, Undersecretary for Field Operation later on. We would like to extend our appreciation to the Department of Education for identifying and acknowledging mental health webinars as capacity development platform to assist teachers with possible challenges that COVID-19 pandemic, among other risk factors, brought to all of us, but also to recognize mental health as critically important health component that requires continuous support. We are also acknowledging presence and support of the Dangerous Drug Board as our long-standing partner in delivering health and drug-related activities, also Department of Health, Department of Interior, and local government, the local government units, the Technical Education Skills Development Agency Authority through ANCO and Saglai-related project venture. I would also like to extend our appreciation to our UN colleagues from WHO, especially Dr. Jasmina Vergara, on her expert support and technical guidance on the subject matter. Furthermore, let me thank our partner, Premier Value Provider, for professional support in delivering this webinar. The last but not the least, let me thank to our UNODC team for their energy, professionalism, and ambition to assist and make the difference with their work. This activity is a result of the response to COVID-19 pandemic in Philippines and a product of UNODC consultation with the INL in early 2020 to address and mitigate negative impacts of the pandemic on at-risk communities, specifically people who use drugs, people with drug use disorders, their families, and communities, by improving the capabilities and skills of service and care providers, by empowering local communities and drug treatment centers to create a safer environment for all. We know that the school setting is one of the communities that has been badly impacted by the pandemic as a consequence of the imposed epidemiological measures that resulted with the adjustment of teaching modalities and migration to online teaching. This is perceived as a stress. And why? Well, new teaching modalities comes with the concerns and fears for the students, for the teachers, but also with the uncertainty related to securing jobs. All of these factors are considered as fueling factors that affects mental health abruptly. Teachers are positioned in the center of the challenge. Their work environment is often perceived as strained due to the always present multitasking requirements, which are now being aggravated with a school system response to COVID pandemic that includes adjusting the teaching curriculum from in-person to online, which is not always easy. And sometimes if we are talking about the skill-based classes, it may be practically impossible. Lack of technical skills and possibilities to use online platforms to deliver, but as well monitoring and evaluation of the class progress and many others. This is why this initiative is well tailored to assist communities in need to reduce stress related to COVID-19 pandemic measures and to affect mental health in a positive way, thus securing appropriate and constructive responses of key actors in ensuring sustained recovery plans. We are thrilled to see that more than 5,000 teachers have been registered for this webinar, which is an outstanding indicator to inform us on the high demand of such intervention, but also on the great interest that is coming from teachers on this particular subject matter. This initiative is just one of the strategies offered by the UNODC as part of the Health and Drug Demand Reduction Work Plan. And do rest assured that teachers and the school system and the school setting generally is positioned in the center of our prevention portfolio with many evidence-based interventions to contribute the current work. At the end, I would like to thank you, teachers, for perhaps the most responsible work that you have in the world, and that being securing positive development of young minds, thus allowing them to thrive and contribute meaningfully to the society. Thank you so much. On behalf of UNODC, I wish you all successful webinar. Thank you, Wina. Over to you.
Thank you very much, Milosh. And now to introduce today's speaker, I'd like to give the virtual floor over to Michelle Marquez, our National Program Officer for Health and Drugs. Michelle? Okay, I think Michelle is having some technical difficulties. So thank you everyone for being here and bearing with us today. We have so many people here in the Zoom room and more than 4,000 people watching. So without further ado, I would like to introduce today's today's speaker, Dr. Homer Yabut, registered psychologist. Dr. Homer Yabut is a registered psychologist and he has, oh, hold on. Sorry. Okay, Dr. Homer Yabut is a registered psychologist, and today we'll be learning a lot from him. He is also a professor at De La Salle University, Manila, and is an instructor with Premier Value Provider, Inc. So without further ado, let me turn over the floor to Dr. Homer.
Thank you, Ina, for that short introduction. Thank you, Milos. Thank you, Ma'am Sheila, for giving me this opportunity to run this webinar about mental health in the workplace for teachers. Good afternoon, my dear teachers. And let's start this webinar by answering in Mentimeter. So I prepared some questions about mental health and of course your personal experiences about mental health so that we can further give context to this webinar. So as mentioned a while ago by Milos, we have different challenges nowadays, especially with our shift to online learning. And then ironically, other teachers I've talked with, they're worried about the shift again to face-to-face. So change is constant during this pandemic, and whenever we have so many changes, definitely it will affect our mental health. Okay, so I will flash my Mentimeter. Okay, so please go to menti.com and then use the code 8175689, or simply click the link given by Wina. Okay, so let's answer this very general question, very Filipino. How are you? Kumusta po kayo? Kumusta ko po sa aking mga kabalen sa Pampanga? Kumusta ko po? So this is a very general question but very important. So let's try to practice asking our colleagues, no? Kumusta po kayo? How are you? So we have 5 choices here. Awful being the lowest, fantastic being the highest. Okay? So if you are not techie savvy, I mean, you can just type in the chat box your answer. Or if you're in Facebook, good afternoon sa mga nasa Facebook, you can just type in the comments if you're not really into technology. Okay, so far, among our teachers, the highest is okay, 48%. Let's wait, no? But we have 18% here. They feel not very good. Later, I will ask some more specific questions, and let's be honest. So this is confidential. Your names are not revealed. So for those of you who feel fantastic, congratulations. Really good, congratulations, and even okay, no? Okay, I will ask you now a more direct question. No? The next one. This one, how's your mental health? It has been already, yeah, 2 years that we have a pandemic, online learning, all these changes in our educational system, and also changes in our lives. So how's your mental health? No, this pandemic really affected the mental health of many people. And of course, we give special focus today for our teachers because we believe in your vocation. You are affecting many lives. So far, congratulations around, yeah, around 30%. They feel good, really good and fantastic. 48%, 49, okay, but around 20%, not very good or awful. Okay, sige po, no? So, our topic is about mental health. May I know what words enter your mind when you hear the word mental health? Okay? What words enter your mind when you hear the word mental health? Okay? This is so mental health is associated with well-being, stress, happiness, state of mind. Let's check, ha? So nakalagay okay, no? Mindset. In the chat box, it's mindset. So we have diverse meanings, no? And this is really very important that we can check, no? How people give meaning to mental health. And it's good to know that you don't only focus on the negative. So many of you answered well-being, okay, happiness, feeling good. And but the biggest words so far are stress, uh, okay. But this is a very good activity, no? Even if you are plenty, we can still check what are the trends on how you define mental health. Okay, you can you can also type in the chat box. Family is the key, sanity, right? Now, um, let me ask you another question. As teachers, what are your current concerns or problems? Not necessarily about thinking about teaching in general, but yeah, it can be family, personal. What are your current concerns and problems? Okay. In the chat box, may nagsabi financial, stress, money. Ayan. Mukhang nagtatap si money. Family problems, health condition, COVID-19. Okay. Maybe if I will ask a question about COVID, majority or many people will answer they were positive at one point or another. So COVID is still here. Someone mentioned in the chat learning outcomes of my pupils. So if you're the type of person na you are really concerned about many people, of course, you are concerned about your students who are not attending classes or not responding. I have some friends who really went to the houses of their students just to check on them, no? So see, as teachers, we don't only problematize our own mental health, but also the lives of our students. And I think that makes us great teachers, no? The marginalized, the lost students. Okay, so The biggest words are health, financial, and money. Okay, before I start, I'll ask you one question. This is easier, no? If you think of symbols or metaphors which can capture your mental health issues, ano po yan, no? Or how will you symbolize your life right now? Um, Meron nagsabi dati, basahan. Feeling daw niya, basahan siya because ang dumi-dumi na raw niya. So how about you? What objects or metaphors enter your mind, no? Uh, Roller coaster yan. Mahilig sa mga carnival, no? Ano yung mga roller coaster? Up and down, rain, dark. Okay, rain. Meron nagsulat dito, candle, no? Sarap sigurong tanungin, no? Please explain, but we don't have time, no? Always empty. Okay. Flowing water, rock. Of course, some are positive, some are negative, but it's diverse, no? That's the good thing, no? We cannot simply say we're all in the same in terms of our reactions. Yung iba nga, they worry, bakit ako positive? Okay lang. It's okay, no? Okay, so the biggest words are will, money, butterfly, roller coaster, sponge, meron dito nagsagot, pot of gold. Okay, thank you for your answers. I will now share my slides, no? So again, welcome to this webinar about mental health in the workplace for teachers. I am Dr. Maria But. So I've been talking to teachers and also students, no? So later on, from time to time, I will share uh, my learnings too. So mental health among teachers during the time of pandemic, that will be the first part. Identifying common mental health issues in the workplace, especially in school setting, and detecting red flags. That's the second part. For the last part, caring for our mental health. Okay, so as early as last year, many experts already mentioned that mental health is the next pandemic. Early 2020. So it's already 2022. So it's the other pandemic we're facing. But let's focus first on mental health. It's related to your overall health status. And it's not just about the absence of mental illness. Our main focus here is our well-being. So even if you don't have a mental illness, it doesn't mean you are perfectly okay in terms of mental health. It's more than that. Our keyword here is flourishing. You thrive? A checklist ha? Or do you thrive? Alam mo pa yung reason. Bakit ka teacher? Are you happy with your teaching? Do you find meaning in your life right now? Teaching as a parent, well-being. Do you actualize? Do you still grow as a person? And can you contribute to society? So this is flourishing. And flourishing is connected to good mental health. So the opposite of flourishing is poor mental well-being. Pwede naman wala kang mental disorder, but it doesn't mean you are already flourishing. In fact, no mental disorder and mental disorder, they are on a separate continuum. In fact, some people discover their flourishing when they have mental conditions. They're broken, they're wounded, but they are flourishing. They realize that life is more meaningful after their bout with COVID. They have insights about life after being depressed. So mental health, mental disorders, they are distinct concepts. In the Philippines, we now emphasize mental health. Thanks to our legislators, the Mental Health Act of 2018 is now fully, not really fully, is now being implemented. No, um, it's about our abilities and potentials, how you cope with stressors in life, and being resilient. And are you still productive as a teacher, no? Can you still prepare your lessons very well? Can you still discuss or record a video for your students well? Uh, and you can still make positive impact in your community. So mental health is more than maintenance, no? That is why during lockdowns, many people got sad, lonely, depressed because they don't feel that their mental health is being maximized. So, kanina you mentioned symbols, metaphors, no? Many answered roller coaster, sponge, dark, rain, candles. One of the most common answers is a broken vase or broken glass, no? Wasak, no? Broken, no? So this they think they feel that their lives are broken because of this pandemic. Broken dreams, lost dreams, shattered goals in life. Yan, no? Ang daming what if, but yeah, they feel broken. So I'll show a short video which can capture the most common uh, experiences of during this pandemic.
The current challenges brought about by COVID-19 for people all around the globe are unparalleled and have caused fear, anxiety, and uncertainty for so many of us. We are all going through this together, and it's important to understand that you're not alone in how you're feeling right now, and that there are practical, healthy ways to cope with these emotions. The COVID-19 pandemic has created unprecedented change and a need for a response from everyone around the globe. Many of us are worried about our loved ones and our livelihoods, and there is no one right way to cope with what we're experiencing. Remember, however you're feeling, there are others that feel the same. You are not alone. Here are a few voices of people struggling to cope during this time.
Some days I'm okay. I'm doing my best to adjust. But yesterday, I couldn't stop crying. This all just seems so unfair, and I feel so angry that this is happening to us. I'm struggling to care for my kids and work from home at the same time, and I'm worried about my parents' health. I watch the news and it just seems so hopeless. I don't know how to keep it together.
I feel so lost and sad. So much has changed. I used to have dinner every week with my family, but now I can't be in the same room with them. I really miss them.
I'm missing out on my prom and my graduation. I've literally been looking forward to these things my whole life, and I'm heartbroken.
With everything going on now, I just can't stop my thoughts. And physically, my chest hurts, and I can't breathe. I get nauseous thinking about what could happen to my family and my friends.
Before this happened, I used to worry all the time about getting sick. Now that worry has turned into absolute terror. My heart races every time I have to go to the store. What if I bring germs home with me? I can't stop washing my hands.
No matter how exhausted I am, my sleep is still terrible. I just keep picturing all the things that could possibly happen. Will I ever get a good night's sleep again?
I've been through so much already. I don't know how I'm gonna deal with this too. My flashbacks are getting worse and worse.
Honestly, I feel like I'm more comfortable in times of crisis. I'm not sure why I don't feel as upset as everyone else does right now.
I don't know when or if everything is going to get back to normal. I feel like the weight of the world is on my shoulders. How many people are going to be affected? What does this mean for me and my family?
We've just heard some of the ways people are being.
Okay, so those are the most common reactions of people with COVID-19, and it's brought about by multiple stressors. Prolonged physical, social distancing, economic problems, unemployment, and uncertainty, no? when is the next lockdown? That's the common uh, worry of people, no? Or when is the next surge? So the individuals experience fear, worry, loneliness, depression, anxiety, physical threat, and of course, distance from our support systems. Uh, this is already cyclical, no? And we don't know until when. And for others, that already brings various stressors. So EVP conducted a survey months ago or years ago, when the pandemic was s- only starting, and we found that majority of our respondents had anxiety. No, in fact, 87% had severe anxiety levels, and most millennials and Gen Z were mostly affected. Okay, so ano yun, no? Negative correlation. So the younger people, they are more prone to mental health issues. Okay, and then employees who work from home during ECQ had higher levels of anxiety. Okay, and yesterday, uh, there was a news article, and with these findings, no, the mental challenge, individuals with depressive disorder, no, the government launched a new app about mental health, and they found, no, around 1 million, no, with depressive disorder, half million with bipolar, 213,000 with schizophrenia. Of course, I think this is just a screening test, but these are already depressive symptoms. Another alarming sign: 1,375 suicide-related calls received by NCMH. And in terms of children, maybe your students, no? Some of them or few of them, um, calls from children received by NCMH, 2020, 11,000, 2019, 313,000. So there's a big leap, no? 8,000, additional 8,000. And last September, I think 2020, DOH released a memo wherein suicide cases were increasing. So, as you can see, mental health problems are very common nowadays. So, it's best that we take care of our mental health. As teachers, we should take care of our mental health since many people depend on us, especially our students, colleagues, family. Having good mental health helps us to perform our key roles and responsibilities. So people who previously coped well are now less able to cope because of more responsibilities. Those who had mental health condition, they had worsening of symptoms. So bottom line, regardless of your status, you should have more efforts, no, to display healthy behavior because we perform key roles within our families, communities, and societies. And this is very important to our community's economic recovery. In fact, the government released just before the pandemic the DOLE Directive Order 208, mandatory for all organizations to have a mental health workplace policies and programs. And they should be developed, implemented, and evaluated. All of us, including non-mental health professionals, should participate when organizations implement or formulate these mental health policies and programs. So let's now discuss for the second part, common mental health problems and issues. I have some questions uli po sa inyo, no? Let's reflect once again. So when we talk about our problems in life, ano po yung mga, let's discuss mga, sorry. Okay. So let's focus on symptomatology, no? So as teachers, I'm having problems lang no, in my connection. No? Okay, for this question, Which among these have you experienced lately? Okay, so loneliness, difficulty sleeping. Sige, let's check, no? All right, so excessive worrying is the top, no? Irritability is second. The last one is worthlessness. Again, if you cannot type or if you don't want to access Mentimeter, you can just type in the chat box or in Facebook comment. Alin po yung nararamdaman nyo lately, no? If you want to elaborate, like you're worrying, ano po yan, no? What are your worries? Ayan, no? Ayan. So the top one so far, it's excessive worrying, followed by difficulty sleeping, and then irritability. This is common among teachers, no? And also among employees. Can you guess which is common among students? Just to give you a trivia, no? Ano po kaya yung common with students? Which is the usual top one among senior high school or high school students? Can you make a guess? You can type sa chat, no? Oh, may nag-chat. Teachers feel helpless. Okay. Sa students po, ang pinaka-common with them in my webinars, it's feelings of worthlessness. That is very common, no? It's always at the top, no? Okay, we need someone who will listen to us teachers. Yeah, that is very important. Kaya we really value you po, no? As teachers, we should really take care of our teachers. Okay, for the second part, burnout, difficulty in concentrating, cannot enjoy pleasurable activities. Sige po. Ano yan? Overeating or undereating, no? Sige po. Let's now focus on this. Which ones are do you feel, no? Sabi ng iba, we are already very tired, haggard, burnt out. That is really very difficult, no? Multiple demands, multiple stressors. Okay, I'm worried about this, no? Cannot enjoy pleasurable activities. Hindi na makapag-enjoy sa watching Netflix or having leisure. Okay, so thank you for your participation. These are very interesting results. Yung at least fifth one yung recurrent dreams, no? So the top is burnout and difficulty in concentrating. Okay. So let's go back, no? I will now discuss the common mental health problems in the workplace, specifically for teachers. When people discuss mental health problems, unlike physical, hindi naman yan sasabihin na meron po akong sakit ng ulo, may headache ako. That's easier for physical health. I have sore throat. But for mental health, it's quite different. It's not very direct. For example, Joanna is a grade school teacher who was recently promoted as a subject coordinator. Recently, she feels nervous and perspires without any reason at all. She cannot focus on her work. She is masipag, determined, hardworking, but there are days that she cannot simply function. Joanna is a composite of my clients, no? Typical complain, typical complaint, without any reason. So mental health issues can start from can manifest as physical symptoms like palpitation, nervousness. Okay, the other one, Henry is a professor in a university and has other engagements as a psychologist. No, he conducts webinars. One day, nagkaroon na he lost his taste and smell, sense of taste and smell. Because of these symptoms, he decided to have himself tested, and he was tested positive. No? During that bout with COVID, he experienced anxiety and felt sad or even depressed during those weeks. So COVID, you have your normal life, regular life, then all of a sudden you have COVID, anxiety, loneliness, depression can enter. No? And trivia, no? Henry is me. Ako po si Henry, no? So I also experienced mental health problems when I had my bout with COVID. So it's indirect, insidious. No, mental health problems are really like this. No, so poor mental health is characterized by many factors. No, significant disturbance in your cognition, how you think, how you feel. No, emotional regulation, feeling sad, feeling happy, and it can lead to poor mental health. Several factors can lead to poor mental health: biological, social, and environmental. So we use this framework, no? So when your student, example, no, open secret naman, no? Many schools nowadays experience may suicide cases. You don't simply ask what caused the suicide. You don't simply ask, bakit siya nagpakamatay? Okay lang yon, but there are many possible answers. It can be biological. There's genetic vulnerability. It's immune stress response, physical health. I know of some people who committed suicide because they had COVID. In fact, false positive pa. Nagpakamatay, after that, autopsy, negative naman sa COVID. Especially the elderly, no? Social factors, toxic colleagues, toxic environment, the culture, school culture, no? Of course, the culture, if we will compare private and public, it's also different. Okay, and then psychological. Some people are really resilient. Some people are weak, no? Some people have high self-esteem. So it's really a combination, no? We call it the biopsychosocial model, no? So mental health problems arise if people have social pressures, and then they have poor coping skills, and then biologically they are predisposed. Okay? So when we talk about social factors, may mga risk factors involved. For example, inadequate health and safety policies in your school, poor communication and management practices. That is why if you're administrator, when you make decisions, it can also affect the mental health of your employees. Limited participation in decision making or low control over one's area of work. Low level of support for employees. I like the comment a while ago. We need people who will listen to us teachers or who will support us teachers. Inflexible working hours. I've heard many stories of in the workplace, colleagues or bosses calling them at late at night, during weekends. There's no work-life balance. And then unclear tasks or organizational objectives. having meetings for 4 hours without any clear goals. So all these things, these are risk factors. So how does it affect the employee, the teachers? Stress, anything which disrupts your performance. Pero of course, worst form of stress can lead to burnout. Burnout, physical fatigue, low energy, umaga pa lang, you hate Mondays, you're already tired Monday, Tuesday. Emotionally also, you're too exhausted. And then you have poor mental agility. But don't worry, stress and burnout are still usual. What is already clinical, it's anxiety. This is already clinical in a way na it can affect you in many ways. Persistent worries, difficult to control. The operative term is difficult to control. Kahit anong gawin mo, nandyan lagi, no? Takot ka magka-COVID, and then you perspire, you have palpitations. Later, I'll discuss the more specific symptoms. In our research, who are predisposed, no? Civil status is single. So these are the typical people na based from our research during this pandemic, single, work from home, and then Gen Z, bata, and then living alone, no? Kaya yan, no? Think about it, no? Anxiety. And then depression. Depression, ito naman yung you really feel down. Intense feelings of sadness. Loss of interest or pleasure in most or all activities. You feel worthless. Wala kang kwenta. You feel it's better to die, no? Because you feel you're not worthy anymore to live, no? Depression is a leading cause of disability, no? It disrupts, no, physical functionality, cognitive decline, and it can affect our planning, organizing, and problem-solving tasks. Profile, risk factors, civil status, again, single, but from 4 to 8, 8.39. Work setup is work from home and living alone. Age is 25 and below. So these are the risk factors. How about for PTSD? This is especially for people who had COVID, especially if it's severe, critical, or for people whose family member who had family member or family members who died because of COVID, or pwede ring students who died. It's triggered by sudden, very terrifying or violent events that could cause nightmares, flashbacks, and extreme anxiety. This is common in areas of disasters, earthquakes, disaster, even conflicts, armed conflicts. That is why, we will have personally, no, I have an activity soon, no, with survivors of a death, no, because we have to talk about their experience. Another thing, no, even during this pandemic, we receive reports of substance use disorders, not only in the workplace, but also in schools. This is about the forces, the craving, the loss of control, compulsion to use, and people use it despite consequences. So it's a mental health issue, no? That's what we've been fighting for ever since. Substance use is a mental health issue. It's not just about a criminal angle. So it's a mental health disorder recognized by the ICD-11 and DSM-5. And here's the catch. Many individuals who develop SUD are also diagnosed with mental disorders and vice versa. Which came first, we don't know. But here are some 3 pathways. Common risk factors: genetic, epigenetic vulnerabilities, exposure to stressors, people with PTSD, no? Halimbawa, no, you feel very terrified, no? Nowadays, we have a new generation of alcoholics because of COVID-19. Many people are really coping through excessive alcohol use. Mental illness, number 2. Persons with severe, mild, or even subclinical mental disorders may use drugs as forms of self-medication. Then, third, substance use can contribute to the development of mental illness. So these are 3 possible pathways. Okay? So when we treat people, no, treatment should be integrated for comorbid drug use disorders as patients demonstrate poorer treatment adherence and other treatment adherence. Okay, so now, after hearing many things, participation ulit, how do you know if you're still okay? What are the red flags? I have 5 questions here, no? Yes or no? Please answer in the chat. Or do you look forward to the future? Yes or no? Excited pa ba kayo Chinese New Year? Chinese New Year or Holy Week? Number 2, do you still sleep well? Yeah. Number 2, do you still sleep well, no? Sige po. Excited ba kayong matulog? Yeah. Okay, so I see mixed answers, no? Others are saying not much, no. Number 3, do you still eat well? Yan, excited pa bang kumain? Ako bilang Kapampangan, I'm still very excited eating, no? Yung iba kasi si ma'am may diabetic daw, no? Yan, no? Number 4. Ano nga sarap. 4, do you still find time to have leisure? Ayan. Do you still find time to watch Netflix? Yan. To exercise? To watch debates? Debates, presidential debates, or anything, no? Or play games? So, leisure, anything, no? In fact, to be frank, even sexual activities, no? Later on, if you don't find time or if you don't enjoy anymore pleasurable things, those are red flags for depression. Number 5, can you still function well? Can you still function well? Okay. Yung masasabi niyo pa ba na you can still function very well, no? Ako personally, I cannot say na perfectly, yes. Because lately I've been sickly, no? I had my COVID and then maybe my physically I'm not yet 100%. Kaya I cannot say perfectly yes, no? But in other aspects, I can say yes. No? Okay, sino po sa inyo yung 5 out of 5? Yan, congratulations if perfect, no? Siguro ano lang, show of hands, no? You're thumbs up if you got perfect score of 5, no? Yan. Pwede rin po kayo mag-thumbs up para makita natin, no? Okay. Ngayon, sino yung no lahat? 5 out of 5 no. Pag lahat no, that is very problematic, no? You should seek help, no? Or find someone na makausap niyo po, no? Okay, mabilis na lang po to, no? Sorry, overtime, but these are all very important. Depression, the red flags are nervousness, restlessness, irritability, preoccupation with aches and pains, passive and withdrawalness. No? So as you can see, these are physiological symptoms. Mind, body, they're interconnected. So it's insidious. Sometimes you cannot really clearly detect, no? There's something pala. Okay, other signs, back pain, loss of concentration, appetite, and weight changes. Hindi makatulog, sobrang tulog, hindi makakain, sobrang kain. The opposites. Okay. And in the workforce, in your students, it's hard to detect depression because as you can see what depression feels like. Second, on the right side, how it looks to coworkers. It has many faces, no? That is why it's really hard to pinpoint na, this student has depression. My colleague has depression. But from this slide, at least from the left side, you can see na what depression feels like. Deep feelings of sadness, loss of interest, difficulty concentrating, forgetfulness, trouble making decisions, energy loss. Kaya nga after my webinars, teachers message me, I think I have a problem, no? Because all these months, they've been denying all these things. Okay, anxiety red flags, excessive worrying, fatigue, difficulty concentrating, restlessness, gastro. I've had my anxiety bouts also, no? Panic attack, no? Like every night, going to the CR, no? Sleep disturbances or heart trouble, palpitations, no? Of course, the safest is to have your heart checked, but if it's clear from the cardiologist, maybe it's anxiety, no? Don't assume right away it's anxiety. So there, no? Emotional, no? These are generic. Irritable, sensitive to criticism, loss of confidence, loss of sense of humor, committing more mistakes than the usual, poor concentration and attention, poor decision making, drop in work performance. And behavioral, you are tardy, dati hindi naman, no? Acting out, you are always noisy in meetings, in class, you act differently, failing to meet deadlines, being introverted more or extroverted. Okay, so let's now proceed to the last, no? Caring for ourselves, no? I would like to know now, paano po kayo mag-cope, no? What are your strategies coping, no? Yan, no? What do you do to cope? Sige po. So, we have options here, sleeping, praying. So the assumption here is that when you have mental health problems, you will not just let them be. You will do something. Okay? Others, we all have different, no? Others attack the problem right away. Okay? But others are behave differently, no? Sige po, no? Pray, watch, galing, no? Eat. So our dear teachers most of them are prayerful. Okay, watch, no? Yeah, if you want to share what you're watching, you can share in the chat box, no? Yeah, that's very good, no? You still have you do many things. Ako, lately I've been watching Netflix, The Manifest, no? I'm already on the 3rd season, no? Yan, The Manifest. Yeah. How about you? Ano pong pinapanood din dyan, no? Wag lang po puro presidential debates, no? You might get stressed instead of relaxing, no? And then hobbies, those are also good, no? May nagsabi dito, gardening. Yung sharing stories with others, these are Zoom kwentuhan. Okay, the list is shopping, no? Looks like many people already you don't have money anymore to buy many things in online shopping, no? Okay, so it's nice to know na most of you are into praying and watching. Now, let's be more direct, no? Cope is different from self-care, no? Although sometimes they are the same, no? What do you do for self-care, no? Yan, no? Yung iba nag-ano raw, spa or massage, no? Yung iba, they travel to a place na relaxing, no? Ako, I have the luxury, no? I mean, sometimes I go to Clark just to relax, no? There are so many trees in Clark. I go biking. That's my form of self-care, no? Yeah. So what do you do, no? As teachers, ay, we do many things. But yeah, and what do you do for self-care, no? So if you don't have any answer today, think about it, reflect about it. Ayan, eating plenty of fruits and vegetables. Wow. And self-care doesn't have to be expensive, no? In fact, not doing anything every Sunday, it's already a form of self-care, no? No emails, no chat, yeah, no work-related activity. Oh, not having time for myself. I'm sorry to know that, no? So maybe we can learn from our colleagues, no, what they do, no? Yan, social media blackout. That's also very good. And politics blackout. Some people every day in their life they post about politics. That can be very stressful for you also. Okay, so thank you for your answers, no? Let's now proceed to the last part. I'll give you some tips, no, on how to do self-care. It is so important to take time for yourself and find clarity. The most important relationship is the one you have with yourself. I remember nung bata ako, no? Siguro most of you bata pa rin, no? Yung sinabi na may song, the greatest love of all. Learning to love oneself is the greatest love of all. I like that song, no? Before loving your students, other people, let's focus first on ourselves. Self-care is not, after all, as they say, self-care is not selfish. Okay. Ayaw mag-work ng aking okay. The first one, no, on a macro level, school administrator should focus on protecting mental health, no, by reducing work-related risk factors. Again, time and time again, I've been hearing stories of the supervisors giving many tasks to teachers, demands. So let's make the workplace as healthier, and then promote mental health by developing the positive aspects of work and the strengths of employees, and then address mental health problems regardless of the cause. We focus on support, providing support, um, promoting work-life balance, and then important kasi, like for example yung in the DOLE directive order and the mental health law, psychosocial support should be given by organizations. Halimbawa, no, may mga problema sa inyo sa family, your colleagues can help, no, by giving psychological first aid or peer support. Okay? Definitely, and I'm plugging already our future activities, no? Psychosocial support and peer support, these are very important, no, for our colleagues in the workplace. Okay, individual level, what can we do? Engage in non-work hobby. That's the first one, no? Do you still have hobbies? I'm curious, no? Ano ako, Marites. What are your hobbies? Can you type again in the chat box? Make time for relaxation. If you don't have hobbies anymore, that's already, ano, no? Mahirap po yun. Ako, my hobbies, biking, no? I biking sa nature. I love that, no? Because it's for my mental health. And then praying, no? That's important. Yung third is arriving to work and leave on time every day. That's more on the structure. Start and end on time. It's not work from home doesn't mean work all the time, no? Okay, I see here things here. Plantito, reading the Bible, no? And praying also is very Filipino, no? In the Filipino culture. Going to mass. When I had when I had a session with COVID survivors, when they were in an isolation, they kept for whole day lahat ng masses inattendan nila. Kaya po masses, okay? So that's what they did, no? Okay, let's talk about this. Gratitude and optimism. We are under challenging times. But we should also focus on the positive things. For example, spending more time with your family because of work from home. In fact, that's a new concern of many teachers. I'm already used with this work from home, online learning. I can be with my kids, teach them, with my family, cook for them. I don't know how to adjust with face to face. That's another thing. But let's focus on this. This is my last Mentimeter question. What are the things you're thankful for during this pandemic, no? Ano yung pinagpapasalamat po ninyo, no? Even if we have a pandemic, ano yung mga things you are still thankful for? Yan. This is very powerful. Instead of us wallowing in our miseries, one form of good practice for mental health is gratitude. Gratitude. Okay, life, God, friends, nakakaraos, more time with our family, okay, healthy mindset. Without this pandemic, I don't know if we are together today, no? Kasi once upon a time, face-to-face, everything is face-to-face. We don't have this concept of webinars. So now, I'm talking to you. Some are from Mindanao. Some are from very far places. Yeah, so this is also, I'm also thankful for this opportunity. Okay, so many good things to be thankful for. I'll return to my one quote that I really like is this one by Meister Eckhart. If the only prayer you ever say in your entire life is thank you, it will be enough. It will be enough. So before sleeping, thank you, Lord. Thank you for all these things. Another thing that we have to focus on is mindfulness. When you start thinking about many things, focus on the here and the now. Focus on your breathing, accepting yourself as who you are. Let's not dwell on the past or future. Mindfulness is very effective against anxiety. Now, if you have many emotions, the first step is to recognize them. Let's practice ruler. The first important thing is to recognize your emotions, no? Not only in yourself, but also in others. And then try to understand where is this coming from and where does it lead to. Many people kasi they are in denial, no? They don't want to own their anger. You have to recognize that, understand, label. Sabi nga nila, give them a name and then express them. Of course, regulating emotions is very important. And if you want to practice ruler with the help of a mental health professional, it's better if you think it's difficult for you. Okay, peer support. This is embedded in our culture. Damayan, no? We give support to others. Support pertains to the feelings of empathy. We can see this during difficult times. People helping others during deaths. We give a buloy, nakikipaglamay. As teachers, we should give support to our colleagues who are having difficulties. And I've heard many stories, no? COVID colleague them colleagues giving donations, giving money, giving emotional support. Kanina someone mentioned taking social media break. This is very important, especially now during election season. Social media break. Ako nighttime no more social media or at least a lot time, no, where you're not connected. And among adolescents, Facebook can lead to depression, Instagram, because they keep comparing themselves to others. And then avoid overthinking, no? We need to undo our unhealthy beliefs about ourselves, others, and the world. Let's not always think bad, negatively about others. Let's stop comparing ourselves from others. No? This can lead to depression, to other mental health issues. And that is why the digital world affects students negatively because they keep on comparing, no? Oh, TikToker, yung classmate ko, ako, hindi ako marunong, no? And then, of course, as teachers, we should find time to do physical exercise, regular routine. Healthy mind, healthy body increases our productivity. Let me end with this image. No? I mentioned a while ago the broken vase, the shattered vase. In the Japanese culture, kintsugi, it's very beautiful. No? Instead of throwing away a broken glass, they try their best to mend the pieces with gold. No, it's more expensive, but this is very meaningful. No, our lives can be shattered or broken, but hopefully with our physical resources, with the help of other people, or with the grace of God, we realize our full potentials. As mentioned here, you won't realize your full potential until you go through the tough times. This pandemic made our life very difficult. But as they say, tough times don't last. Tough people do. And with our support for each other, from one another, we can be better people. No? Broken, but still beautiful, just like in the kintsugi. Wounded, but still beautiful. And let me end with this quote for teachers. True teachers are those who use themselves as bridges over which they invite their students to cross. Then, having facilitated their crossing, joyfully collapse, encouraging them to create their own. So I hope you take care of your mental health to become strong bridges for your students. After all, there is no health without mental health. Thank you very much for your cooperation for today. I think we still have time for Q&A, no? So let's go back to Mentimeter, and Wina will help me in the Q&A part. Thank you.
Stockholmer, I think people are still typing. Let's just give them a couple of minutes.
Yeah. Okay, so thank you for I hope you were able to reflect also about your mental health. It's again once again thank you for this opportunity to talk in front of you. What if I have no money, therapy and everything seems so expensive, wala pong budget? Well, this is a valid question, no? the going rate for therapy now, it's between, the lowest is, you're lucky if you can find 1,500. No? It can be, it can can be as high as 1,000. It can run as high as 5,000. I think the solution here is capacitating our teachers, no? This type po sa ano, no, sa not on the chat box so that we can check your questions. That is why we need to develop or capacitate our teachers to have peer support. I mean, to develop peer support, psychological first aid skills, so that they can help kayo po, no, you can help your colleagues, support them in a way na you can help your colleagues, give them, provide basic helping, em, em, uh, empathic listening. So those are very important, no? At least they will feel that the school cares for them. No, yun yung ano eh. Kasi if we will all rely on paying for therapy, not everyone needs it eh. But it's a good thing if school administrators can allot budget for therapy, no? Miss Wina? Ang daming mag-attend ng...
Yes, Homer, ang dami pong questions. I think, wait lang po. Okay. Meron pong nag-ask na about yung sa students po. Since na-mention niyo rin earlier na students are a big concern, of course, of teachers. May nagtanong po, paano po kapag yung mga estudyante namin nahihirapan, pero kung tulungan po namin sila, mas stress din po kami kapag tumulong?
And that's a very valid question, no? Meron akong mga na-encounter na schools na wala silang guidance counselors. And my main concern is dual roles. Mahirap po yun, no? Na you are the teacher and at the same time, the guidance counselor. There's already duality, no? Kaya I think you can still help guidance counselors, but the main challenge is to really empower, capacitate our guidance counselors. And then how teachers can complement, no, the guidance counselors in terms of roles or responsibilities, no. So there, no, definitely pagod na po yung teachers, tapos pati mental health ng students sa kanila pa. That is really, those are risk factors, no? Those are real risk factors, no.
Doc Homer, I think yung question with the most upvotes right now, so I think a lot of our teachers in the audience really relate to it, is the one on screen.
Yes,
so,
yes.
Yes.
Yeah, I've been talking about this kanina pa, no? Yeah, the administrators, no? So this is real talk, no? If some school administrators are here, I hope you reflect about it, because examples nito, yun nga, long meetings, many demands, even beyond office hours, even during weekends, and then of course the politics when there are promotions, and then of course in the government, items, hiring people because they know a politician but leaving out the more competent ones. But these are not under our control, no? So yeah, it's really it's really difficult, no, maybe we can have a webinar or just for school admins, no? That's another thing, no? On how to help teachers. Yeah, no? Yeah, so many questions po, no? I maybe we can, Wina, maybe one more.
Sure. I think
How I
this
wish.
one, Doc Homer kind of cuts across
Yes.
everything else. So maybe people are asking if they are not mental health professionals, does that mean that they shouldn't help? Or how can they refer? When will they know when they can refer? Or is there any type of training they can undergo, something like that, even if they are not mental health
Yeah,
professionals?
yeah. In one of my advocacies, personal advocacies, with the help of PVP, ay yung ano, capacitating non-mental health practitioners on how to provide help, no? Through peer support or psychological first aid. Um, because we cannot do it alone. We are very few. It's like all we have very few psychologists in the Philippines, no? And of course, others cannot afford. So we have to bring psychology closer to the people. Kaya even in the mental health law, that's the what's one goal, no? Every LGU, every school, every organization, they should have mental health programs in collaboration with, for example, LGU in collaboration with the teachers, the church. So yun, no? We train people how to detect, how to give help, how to provide basic helping, and how to refer, when to refer. Mga ano, so ang bottom line, psychologists only handle yung having worse symptoms. So that's the framework, no? Otherwise, we will have many people who are in denial or not knowledgeable. In fact, simple webinars like this can already, ano, no, can educate people, no? This is the first step. This is just the first step. But others think that this is the only step. So there, no? Community psychology, no? Community mental health approach. Okay, so there are 55 more questions. We will check these questions po, no, with UNODC, and then we will see what we can do, no, in the future. I will stop sharing, Wina. It's already time. Thank you.
Thank you very much, Doc Homer, and thank you everyone for a lively Q&A. Now, I will turn the virtual floor over to Michelle Marquez, our National Program Officer for Health and Drugs. Hi, Michelle.
Hi, Rina. Thank you, Dr. Homer, for the comprehensive, discussion around mental health. Indeed, no, mental health issues is an emerging concern. I think even prior to the pandemic, but then it was aggravated when the, COVID-19 came into the picture. Of course, we cannot address all the questions at this point in time, as there are a lot of inputs, from the YouTube. I was monitoring it, and there are about 7,600 people joining us, plus those who were able to join us in the Zoom room. So yun po, there's an overwhelming response from all of you. So this is like a living testament na talagang kailangan nating pag-usapan yung issues around mental health. And Dr. Homer very well mentioned about community psychosocial
mental health.
Community mental health, because I believe that mental health is everybody's business, and we can be vulnerable at some point, in our life. So ito po ay isa lamang sa series of webinars that UNODC is organizing, and there are other organizations who are also, helping us in the response, especially the World Health Organization. And I'd like to mention Dr. Jasmine Vergara, who is the focal person when it comes to, pushing for the national response on mental health. She has contributed a lot to the framework that was developed. So yun po, earlier, we apologize. I encountered technical issues, and so our DepEd representative, I wasn't able to introduce our speaker, and our Department of Education representative wasn't able also to join us because of some issues, because there were, like I said, there's an overwhelming response to all of you, and we are very happy because at least now we see the need, to discuss further on mental health issues, and of course how we link this, for example, to our efforts on drug use or drug abuse prevention. Let me introduce Dr. Maria Corazon Dumlao, who, because she couldn't join us in the Zoom platform, and so she recorded her message. But let me introduce her. She is actually a physician or a doctor by profession, and she is the Chief Health Program Officer of the School Health Division under the Bureau of Learner Support Services from the Department of Education. And I know her also from long time before, because she is actually an advocate, a drug prevention advocate, and a master trainer for the Universal Prevention Curriculum supported by INEL and the Colombo Plan. So yeah, let's hear from the video message that will be delivered to us by Dr. Maria Corazon Dumlao of the Department of Education.
Good day, everyone. I have the honor to deliver the message of Undersecretary Repsi Escobedo. And I read, my warmest greetings to our distinguished guests, administrators, resource persons, dear teachers, and to all present here with us today. It is a great pleasure and honor to be part of the launch of the UNODC Mental Health Webinar Series for Teachers. The Department of Health just recently confirmed the community transmission of the Omicron variant in our country. Today is a good opportunity to remind everyone that we must remain vigilant in observing health and safety protocols. Our simple acts of maintaining a safe distance, proper wearing of face masks, washing of hands, and getting vaccinated will make a huge difference in our fight against COVID-19. Let us do this not only for the sake of ourselves, but also for the sake of our families and our communities. However, COVID-19 does not exclusively target our physical state. It can also influence our mental health, which includes our emotional, psychological, and social well-being. As much as it is important to strictly observe physical health and safety protocols to avoid contracting the virus, it is also equally important to monitor and assess our mental health. According to the World Health Organization, mental health conditions can greatly affect our daily activities, including work performance and even the connection between our colleagues and friends. This is not simply a matter of it's all in your head, but this is a pressing issue that needs to be addressed, especially during these trying times. We should not be afraid to ask for help. In our commitment towards the continuity of the delivery of quality, inclusive, and liberating basic education to our learners, the department hardly fought for the increase in the budget to provide our dear teachers and non-teaching personnel the necessary support they deserve. Our finance strand, under the leadership of Undersecretary Annalyn Sevilla, assured that all possible incentives are given and released through the directive of the Secretary. Appropriate assistance is also continuously given by the department as a response to the COVID-19 pandemic through the provision of hazard pay, personal protective equipment, and disinfection supplies. The strict observance of health and safety protocols, disinfection of facilities and vehicles, and medical checks of the staff are regularly conducted to ensure the safety of the workplace. This could not be possible without the utmost support of other government agencies, local government units, and external partners. Thus, I would like to offer my sincerest gratitude to all of our partners in our efforts towards the improvement of the conditions of our beloved employees. Furthermore, the department has several initiatives to help both our learners and personnel cope with their stress. The Secretary emphasizes that the department wants to ensure that the mental health of our personnel and learners are being taken care of. While we have consistently conducted mental health, and psychosocial services for our stakeholders during the pandemic, we recognize that looking out for everyone's mental state is a continuous process. This is institutionalized through the issuance of Deped Order Number 14 Series of 2020, or the guidelines on the required health standards in basic education offices and schools. The order lays out a clear protocol not only for the physical welfare of all personnel, but also for the support of mental health services in the department. Through our partnership with several private institutions, we have launched Tayo Naman, Tulong, Alaga, Yakap at Oras para sa mga tagapagtaguyod ng edukasyon, which aims to promote the mental well-being of our personnel despite the pandemic. Likewise, through DepEd Memo number 74 series of 2021, the department promoted and integrated mental health and psychosocial support services in all of its programs and events. Furthermore, a mental health helpline system consisting of the contact details of several partner institutions such as Circle of Hope Community Services Incorporated, COVID-19 mental health responders from the Masters Psychological Services, Hopeline Philippines, and the 700 Club Asia were launched. These organizations provide support services to the general public, including the learners and our teaching and non-teaching personnel in times of mental and psychological distress. On behalf of the Department of Education, I would like to offer my utmost gratitude to the United Nations Office on Drugs and Crime, International Narcotics, and Law Enforcement Affairs, as well as the U.S. State Department for warmly extending their support to us by conducting this mental health webinar series for our beloved teachers. I am fully confident that our partnership will mold our dear educators to be resilient in times of crisis and help their families, colleagues, and communities in this journey of mental health awareness. Mabuhay kayong lahat, lagit lagi, serbisyo para sa bayan. Signed, Undersecretary Rev C. Escobedo.
So Okay, thank you so much, Dr. Dumlao. I know she is joining us through our YouTube Live. And thank you for the very inspiring message from USEC Revsi Escobedo. And we are very grateful for the partnership with the Department of Education. And now to introduce we are just about to finish, but for the closing remarks, I'd like to invite Celia Cummins, the Director of the Bureau of International Narcotics and Law Enforcement Affairs, U.S. Embassy in the Philippines, who is also our very strong partner. Celia, floor is yours. Thank you. I think you're on mute, Celia.
Celia, we can't seem to hear you. But she's not on mute though. Hold on. Hi, Celia. Could you please try again? Hi, Celia. Sorry. We still can't hear you. Would it be possible for, hold on, for you to mute and then unmute?
Okay.
So sorry, Celia. We still can't seem to hear you. Although I can see that your mic is unmuted. All right. Would it be possible maybe for you to re-enter the Zoom room? I'm so sorry. Thank you.
Yeah, and for our participants, please bear with us while Celia is trying to join the Zoom room again.
Hi, Celia.
Hi.
There you go. We can hear you perfectly now. Thank
perfect.
you.
Great. The joys of technology. Talking about pandemic stress. How much stress does the modern technology world causes us sometimes with these events, but that's okay. We can overcome, and self-care is key, as we heard from the great doctor. But good afternoon, everyone. Magandang hapon sa lahat. Thank you all for your active participation in this webinar today. My name is Kelia Cummins, and I am Director of the Office of International Narcotics and Law Enforcement Affairs at the U.S. Embassy in Manila. And we are a proud sponsor of this webinar series. A very, very special thank you to our implementing partner for this project, UNODC Health and Drugs team, represented today by Olivia Lernay, Milos Stojanovic, Shelo Marquez, and the rest of the team. And to my team member, Jonah Santos, many thanks. Thanks also and a welcome to our institutional partner, the Department of Education, under the leadership of Undersecretary Escobedo, represented today by Dr. Dumlao. Thank you, ma'am, for your comprehensive message today. And we would also like to thank and acknowledge Premier Value Provider, who worked closely with UNODC to bring this webinar together. And finally, many, many thanks to our subject matter expert for today, Dr. Homer Yabuth. Thank you for sharing your important, timely, and useful message. It really gave me additional insights into the importance of self-care. Congratulations to all of you, to everyone participating on the line today, to the thousands of teachers and other participants who made it to this launch and actively participated in Mentimeter and the other engagement methods and completed this first session. So just a little bit about a background about what INL is, what we do, and why we're supporting this event. So INL uses a wide range of tools to support foreign assistance efforts to counter crime, fight illegal drugs, and instability abroad. That mandate is very wide and far-reaching, but in the Philippines, INL works with several stakeholders, such as UNODC, including national government agencies, international partners, civil society groups, the academe, treatment professionals, educators, frontliners, and others, in order to achieve our mission. We have many shared goals. Drug demand reduction is one of them. Associated with that are the healthcare impacts related to the pandemic, and that's part of our series with UNODC. We are working together to mitigate the negative impact of COVID-19 on at-risk communities. We have a 2-year project, and we're working together to improve service and care providers' skills and capabilities in order to help them with people affected by drug use and dependence. Schools and educational systems, including administrators, teachers, students, are among those severely affected by the pandemic. And thus, the school setting is one of the target settings of this INL UNODC project. And this project is very near and dear to my own heart because my sister is also a teacher. She's an educator, and I see the realities that she has to face on a daily basis. And as such, to deal with these realities, this webinar discussion, this series will focus on methods for overcoming stress-related barriers in online teaching, on the importance of caring for mental well-being, and an emphasis on fostering student-teacher relationships in face of pandemic challenges. We are happy to note that there will be 2 additional webinars scheduled over the next 2 months, covering discussions on mental health first aid and peer support training. We are so excited to offer and invite you, your colleagues, and friends to these webinars with the hope that it will help mitigate and manage some of the stress during this global health crisis. COVID-19 presented us with unprecedented challenges, but together we can continue to seek inspiration for overcoming these challenges through not only this training, but through collaboration and communication, hearing and sharing stories during this webinar series. With that, I'd like to say all the best to everyone. Keep safe and take care. Thank you. Maraming salamat po. Ang mabuhay.
Thank you so much, Kelia. Now we'd like to ask for everyone in the Zoom room, if you could kindly turn on your cameras very quickly. We'll be having a very quick photo opportunity so that we can commemorate and save this wonderful webinar that we've had today. Okay. Thank you. Okay.
And beautiful faces. Good to see beautiful faces of our participants.
Okay, we have 3 screens, so I'll be taking 3 photos. 1, 2, 3. First screen, smile. Okay, perfect. Second screen. 1, 2, 3, smile. Okay, last screen po. 1, 2, 3, smile. Okay, perfect. Thank you so much, everyone. Before we go, we just have a couple more reminders and also some information for you to be able to claim your e-certificates and for our following initiatives. So first, we'd like to announce that we will be having a mental health first aid training on February 15, 16, and 17 from 1 p.m. to 5 p.m. So you may register using this link or via the QR code. For YouTube and Zoom, we'll be posting the link in the chat also. So let us just post that so that you can click it and access it more easily. Okay, the link is now in the chat box. We would also like to announce that you can claim your e-certificate for this webinar by filling out the evaluation link below or scanning the QR code here as well. We'd also like to ask for your consideration to please give us a week to finish all of the e-certificates, which will be emailed to you because we have really an astounding number of participants for this initiative. Our partners, PVPI, are also conducting a survey that will help us gain more insight into mental health and education in the context of COVID-19. You can also go to this link that is on the screen right now if you would like to participate. Thank you very much, and that's all for our webinar today. Thank you so much again for being here, and we'll see you next time.
And to those who participated in the YouTube platform, thank you for your time. And I could see a lot of comments. And thanking you, Kelia, for the support, Ainel, for the support to the Philippines. You'll see in the YouTube chat. There are so many comments there. So again, as a reminder, please remember that you are not alone. We are not alone.